everybody. I'd like to thank Louise and Logan for inviting me to talk today. I'm a brand new member of a brand new department down at the University of Otago in Dunedin. So I'm representing the Department of Obstetrics, Gynecology and Women's Health, which is a bit of a mouthful, but we are completely brand new, so it's kind of exciting to be here right at the beginning of that. So I'm going to talk a little bit about the focus of my research and hopefully give you the perspective of somebody who's a bench scientist, who's mostly involved in genomics, but who had a bit of an idea and tried to explore how that could become a useful biological therapeutic. Spoiler, it's really hard, and that is, I will give you the example of the idea at the end, and I struggle with it. So it's kind of nice to talk to you from the very beginning of what hopefully will be something useful. But the main focus of my research is pelvic organ prolapse, which has been described as a silent epidemic. It affects 50% of people with female pelvic anatomy who are over 40 years old, and probably about 100% of those over 80 years old. 19% of those people will require a surgical correction over their lifetime, and the big problem lies in those people who then have a recurrence and require more surgical interventions. And the younger you are when you experience a prolapse, the much more likely it is you're going to require a second or third surgery. It causes pain, discomfort, incontinence. You know, it's not life-threatening, but it's incredibly impactful on people's quality of life. People feel a lot of shame and embarrassment, and it's not particularly well discussed. So a little bit of what I'm trying to do is also start a little bit of conversation around prolapse and hopefully help people understand that this isn't just a sort of time of life thing that's going to happen to you, that you can actually seek medical treatment. However, at the moment, the medical treatments available are purely mechanical. We can do native tissue repair surgically, or sort of mechanical supports in the form of pessaries or physiotherapy. And one of the reasons for that is that the synthetic mesh that has been traditionally used to sort of support those tissues during surgical repair has been banned by most of the kind of medical authorities from developed countries. So the FDA banned it, and we have banned it here in New Zealand as well. And that's because of a lot of poor outcomes. This is just for prolapse repair, so sort of hernia repairs and things can still use it. But in prolapse repair, there's been an awful lot of problems with women having sort of tissue erosion and pain that has led to it being banned. So we don't have any off-the-shelf products currently to assist in surgical repair, and we certainly don't have anything that's biologically informed. And prolapse isn't the only thing that I'm thinking about. I'm also thinking about sort of common injuries that many of us will experience to our connective tissue. So these are the sort of layers of tissue beneath the skin that hold everything in place in our body. And I think quite often, especially in the sort of commercialization space, we're thinking a lot about wound healing of the skin. You know, we think a lot about sort of the complex wounds that people with chronic health conditions might experience and how we can biologically treat those. But many of us will experience significant injury to the connective tissue over our lifetime, and there's just some examples up there. And the connective tissue is quite bad at healing itself, and even very small injuries to our internal tissues can take a very long time to heal and cause significant problems and potentially require follow-up surgeries. So that's the kind of the problem that I'm thinking about, and where my idea fit in, I suppose. So I'm a geneticist, so I'm approaching this from a genetics point of view. And I'm a rare disease geneticist, so that's where I'm kind of starting here. So if we consider three populations of people who have pelvic organ prolapse, on your left-hand side there, we're going to have a very small amount of people in our population who have a rare connective tissue disorder, something like Marfan syndrome or Ehlers-Danlos syndrome. But these people have a very high chance of developing a pelvic organ prolapse. We know most of the genes that cause these diseases, and if you have a variant in one of those genes, it has a very high effect on your connective tissue function. you're almost certainly going to have some kind of problem with your connective tissue. Now, if we consider the sort of other end of the spectrum on the right-hand side of the screen there, which is people with a sort of population risk of pelvic organ prolapse. So, as we know, it gets more common with aging, the risk increases after the menopause, but there is still likelihood that there is a genetic influence in those individuals, but the genetic variants that we see in those people will probably have a low effect. So there's sort of a cumulative effect of genetic variation and environmental and lifestyle factors. And these are the kinds of variants we're going to find with large-scale genome-wide association studies. But the group I'm really interested in are those people in the middle. So these are people who haven't got a diagnosis of a connective tissue disorder, but they still have quite a high risk of pelvic organ prolapse. I put a post just yesterday on the Mums of Dunedin Facebook page and got about 30 women in their 30s responding to me saying they'd like to be involved because they've experienced a pelvic organ prolapse. So although we think of it as a disease of aging, there are cases out there where young women have a fairly devastating pelvic organ prolapse and they think that this must be something wrong, going back to that stigma thing, there's something that they have done wrong, but it's probably highly likely to be genetic, with some lifestyle factors in there as well. And the genetic variants that we find in these people will probably also have a fairly high to medium effect on their tissue quality or their integrity of their connective tissue. So the people I'm studying as part of my work are these two groups, and I'm hoping to find, by sequencing their genomes, genes that have a critical role in pelvic tissue strength. But the overall goal is to develop something biologically informed that can actually be used as a treatment for all of these groups of people. So it's actually almost the opposite of precision medicine, I suppose, in that we start by looking at individuals to learn as much as we can about the biology of these tissues, but then using that to inform the development of something useful that can be used in treatments for everybody. So not just in surgery, there's potential other ways of delivering protein-based therapies to these tissues without involving surgery, but surgery is certainly one of the things we're thinking about. Now, obviously the human genome is massive, and finding disease-relevant variants can be very difficult. So I am using a few different approaches to try and find the most useful genetic variation we can with the highest impact. So in my cohorts of interest, I'm looking for rare protein-damaging variants because I'm predicting that these are going to have the largest effect on the connective tissue. I'm also using matched genomic and proteomic data, so I'm actually looking at the proteins in the pelvic tissues of these people who are going to surgery for surgical repair. So I can begin to understand which variants in the genome are having a direct effect on the protein composition of the pelvic floor tissues. And then finally, I'm actually restricting my search to the extracellular proteins. So these are going to have direct effect on the strength of the pelvic floor because it's our extracellular matrix that's kind of holding everything together. But also, if we're thinking about it from a commercialization point of view, these proteins are actually going to be the most useful to deliver in terms of a drug or a therapeutic, because if it's something that sits on the outside of your cell, it's much easier to sort of paste that on or bandage that onto something than something we have to deliver intracellularly. So this is my last slide. This is my example and where it's hard, because that was all lovely. But this is the real world situation. So this is the kind of situation that we work with in rare disease genetics. We have two parents there who have had a son, an affected son, who has a profound connective tissue disorder. This family are actually from Southland in New Zealand, so it's a very New Zealand story. And we found that in this individual through whole genome sequencing that he has the complete loss of a particular extracellular glycoprotein. And when we looked hard at his parents who are carriers for this condition, we saw that they had a fairly high incidence of sort of common connective tissue issues. So his father had a lot of hernias, his mother had a prolapse. And so we thought this protein is obviously really critical in the strength of this connective tissue in these individuals. And so I've had some seed money from KiwiNet and Medicines New Zealand to begin to think about how we could develop this protein into a therapeutic that can be delivered to the connective tissue to encourage its healing or strengthening post-surgery. And so far, you know, I can purify this protein in my lab, and I've been talking to a few people about mixing it with other biomaterials in a way that it can be stabilized and in a sort of off-the-shelf format. And that could be delivered during surgery to strengthen pelvic floor tissues. And just going back to the last talk about engaging with end users, I've also been talking a lot to surgeons about how they would like this. If it was going to be a product, how would they like it? You know, surgeons don't need anything extra to be doing, so how can we help surgeons use it without giving them too much extra to do? But that's pretty much as far as it's gone. It's a lovely idea, but taking something that's a great idea into something that you can sell as a product has been incredibly difficult, especially with someone who is very inexperienced in that area. So it'll be kind of cool to sit on the panel and talk with everybody else about their experiences of that as well. So with that, I'd just like to thank everybody involved, and KiwiNet and Medicines New Zealand are the ones that have seed funded this project, so thank you.